Mental professionals of Reddit. What is the worst mental condition that you know of? Cotard delusion. I'm a nurse and had to take care of a huge man with this condition. He came in with some odd behavior and escalated to Cotard. The delusion makes you think you are actually dead. He would scream he was dead all day and night. Lived in constant terror. He was such a sweetheart, but became so worn down and terrified over time he got quite dangerous and punched a nurse in the face. Dementias. Watching a person, their memories, their personality die, but their body remain living and confused, is horrifying. My grandma died of Alzheimer's. She'd had a baby die of sudden infant death syndrome, EIRC, in the 1930s, when he was about 9 months old. When she finally forgot the last of us, she began asking, "Where's my baby? Give me my baby. Don't you hurt my baby?" It was just about all any of us could do not to fall apart. We got her one of the more lifelike baby doll toys from the toy store and wrapped it up in a blanket to give her. She was so relieved. She'd rock that baby for hours and sing to it. She never asked where her baby was again. Delusional parasitosis comes to mind with this prompt. I've watched a patient go to well over a dozen doctors trying to get confirmation that they're parasite-ridden. After countless stool samples, blood work, labs, scans, biopsies, etc., she clearly didn't have any but remains convinced. A friend of my mom's ended up with something like this after getting into the wrong kinds of drugs. She was convinced that there were little bugs in her face. Absolutely convinced. She'd pick at her face day and night, picked her face skin off bit by bit until the sight was horrific. She got clean for a little while, came to her senses, and stopped picking. But the damage was done. Her entire face was scarred. Though not a medical professional, during my brief time working at an outpatient facility, I encountered a patient with body integrity identity disorder, body perception integrity disorder syndrome, convinced that his arm wasn't his own. He consistently described it as feeling like a stranger's limb. His intense desire to have his arm removed led him into a deep depressive episode, culminating in a self-mutilation attempt that ultimately needed amputation. Post-surgery, he claimed to finally feel sense of peace. However, I left the job, so I don't know the lasting impact on his mental state from the surgery. Body perception integrity disorder syndrome is still a relatively unknown identity disorder and doesn't have many treatment options so far. Selective serotonin reuptake inhibitors are usually given to alleviate depressive symptoms, but it doesn't always seem to help. Paranoid schizophrenia is no joke. I had a PT that was so convinced that aliens were watching his life through his eye, so he tore it out with his bare hand, and didn't even regret it. My mom suffered from paranoid schizophrenia throughout my whole childhood. She thought my dad was trying to kill her and was making a pact with the devil as well as other things. Sometimes she was on meds and was okay, but she'd often stop them after a while. Shit was not fun to be around, and I hope to God I never have to experience it myself. Schizophrenia. Hands down, no contest, 90% disability rate, 30 years shaved off of natural life expectancy, astronomical suicide rate. Common comorbidities include both mental health and physical disorders. Some people still think schizophrenia is dissociative identity disorder, which obviously it is not a multiple personalities. But a less ignorant yet even more common misconception is that schizophrenia is a monolithic disease, that is, it shares an underlying pathology between cases that causes it. The reality is that schizophrenia is nothing more than a cluster of symptoms, and there are many different pathologies that can lead to those same symptoms, part of the reason schizophrenia has a reputation for being the be-all and end-all of insanity. You cannot go more crazy than schizophrenia. It does not exist. Schizophrenia is the end of the road for all madness. This blew up. Apparently it could use some clarification. The thing that makes schizophrenia so dangerous is not the disease itself necessarily, but because it almost never exists in a vacuum and isolated from other disorders. The extreme amount of comorbidities with schizophrenia, including practically every other mental illness, and some physical illnesses, is what makes it such a killer, and the major contributor to shaving decades off of someone's lifespan. That's not even mentioning the meds. They suck ass even if they work to control psychosis. The side effects are legendary for how awful they are. You pack on the pounds like it's nothing. Some of them can cause diabetes to manifest, and any number of other terrible side effects, akathasia, aka perpetual restlessness. It is the be-all and end-all of madness because it bleeds into everything. I have schizophrenia. I have for 18 years. I've worked in mental health for only 3. Unlike these supremely lucky ones who spread trivializing bullshit from TikTok that it's not that bad, schizophrenia destroyed my life. It burned it all to ashes. I was subjected to dehumanizing, humiliating things that are common for schizophrenics to experience: police brutality, public humiliation and ridicule, etc. It took me over a decade to get back on track, to rebuild from nothing. I must admit, I did have a flowery view of schizophrenia, thought with the right approach. There's hope for anyone. If I did it, anybody could do it. Until I started working in mental hospitals. There are people there who genuinely have no hope of recovery, stability, or happiness. Their schizophrenia is degenerative, almost like Alzheimer's. Interventions are of limited effectiveness, if even at all. That's when I realized. I'm one of the lucky ones. My patients tend to be a lot less fortunate. Schizophrenia destroys lives, families, friendships. It is an insidious disorder that can adapt to resist treatment, something no other psychological condition does. It warps the very fabric of reality itself for those who suffer with it. Come see the patients I do. That thought will never cross your mind again after you do. Prosopagnosia. I had a patient with this as a therapist. They reported to the ambulance because their face fell off. The only thing therapy could accomplish was to teach patient how to use other markers to identify people. Capgras syndrome. The idea that the people around you were replaced with imposters. This one is absolutely hell on everyone. And in neuropsych, definitely primary progressive aphasia. Basically, you aggressively lose the ability to speak and understand language. I had a patient once that was late to their appointment, and when they finally got there, they were pissed because none of the signs were in English. They failed all of their language tests, but passed all the other markers to rule out dementia. This person was an avid runner. Vegan, perfectly healthy, and would likely go on to never be able to speak or understand anyone speaking to them within 5 years or so, yet live a long life due to no other health concerns. My prosopagnosia patient had sudden onset severe case. They were fine and then happened to walk past a mirror at work, and they couldn't recognize any facial features that they could identify themselves by or any their colleagues. They were brought to the emergency care in a panicked state, and their chief complaint was just that their face fell off, their exact words. This particular patient had a small stroke to cause this disorder and subsequently spent 3 years in a treatment facility recovering as best they could. I heard about a guy who thought he was on fire all the time he was awake, so he screamed until he passed out. Day after day, how can you even treat that? Ooh. I know a similar story. There was an old guy who did that all the time, exactly as described. No medical professional could figure it out, and nothing helped at all. I'm not sure how they found out, but eventually they found medical records that had been hidden, and no one, doctors, etc. It could see it. It was hidden because it was a massive fuck-up. It had occurred years before he started having a bad time. Turns out he went in for heart surgery, and he woke up right as they started cutting into him. So he felt, saw, and heard everything. It ended up being a repressed memory until years down the line he started screaming anytime he woke up and never stopped. Have a friend who works with seriously disturbed patients and told me about a woman that habitually drank hand sanitizer. Apparently, when you do that, your joints lock up and you have to be immediately rushed to the emergency room for treatment. And what do they have in the emergency room every 10 feet or so? Yeah, more hand sanitizer. So this woman would have to be restrained, otherwise they would find her in the hallway pumping it directly into her mouth all over again. Honestly, Minaya, people's lives get ruined because of one manic episode, thousands of dollars spent, random flights booked, and ending up on the other side of the planet with no way of getting back. The worst part is that while in a manic episode, you feel like you've finally unlocked some secret to happiness. Like all of your depression is gone and you're so motivated and interested in so many things. It all comes crashing down once you're out of a manic state, and you see the wreckage behind you that you can't fix, friendships damaged, opportunities lost, etc. And you can barely remember doing any of it. Childhood disintegrative disorder, nightmare fuel of the highest order. The child starts to regress in development language, and speech starts deteriorating, lowering acquired motor skills, losing ladder control, progressing until they are vegetative and non-communicative. The person that the child was has disintegrated completely. We have no idea what causes it nor any treatments, no detection of it beforehand. But what turns it into pure nightmare fuel is that there actually is one preceding symptom. The child is utterly gripped by fear and intense feelings of something being very wrong with them, often complaining to the parents that something is terribly wrong with them. I work in psych intensive care. We had a guy with autophagia as a form of self-harm. He ate huge chunks of flesh off of his arms when he was hearing voices. That was pretty bad. Drugs are the worst, though. Meth literally burns holes in your brain. I've seen brain scans from patients. Lots of people who are revived post-opiate overdose have hypoxic anoxic brain injuries. It's like they've had a lobotomy. It's awful. Those drug-related brain injuries are permanent too. They'll never be able to live independently ever again. Anorexia and borderline personality disorder have the highest all-cause mortality risk and suicide risk. Both reduce life expectancy by about 20 years, and if they're in combination with other disorders, substance abuse, etc., even more than that. This is partly because of increased suicide risk, but also due to factors like increased risk of unhealthy lifestyle, the combined metabolic burden of substance abuse and medication, and the effects of constant stress. Also increased risk for blood-borne diseases, sexually transmitted diseases like hepatitis and others. Because of risky sexual behavior, 10% of people with borderline personality disorder commit suicide for borderline personality disorder. This percentage is skewed heavily towards men. 20% of men with borderline personality disorder commit suicide, but only 5% of women. This is at least partly because men often choose more immediate methods like jumping or firearms. That's not attempts, that's actual suicides. More than 3 out of 4 people, 79%, with borderline personality disorder attempt suicide at least once in their life. Clinical depression. Sitting in a room with someone and you can feel the void around them. It's like a complete emptiness. I worked with someone who accidentally set their bed on fire while smoking and was just watching it, like they were watching daytime television. Zero emotion and zero reaction to move from it. It's chilling. Thank you for watching this video to the end. Post in the comments what scary mental illnesses you know. Be sure to subscribe to our channel so you don't miss out new super interesting videos, and I also suggest you to watch our other videos.